Welcome to Painfully Living with Katie Clark. Join me as I share how to live more fully despite chronic pain. Please welcome my guest, Dr. Michael Lenz, as we discuss the ADHD fibromyalgia connection. Hello, this is Painfully Living, where I share how to fully live despite chronic pain. And today I have a very special guest, Dr. Michael Lenz, who is a pediatrician and internal medicine practitioner in Wisconsin, who specializes in lipidology, which I believe has to do with heart health and lifestyle medicine. And I think that you're a bit of a unicorn when it comes to the fact that you have written a book on how to conquer fibromyalgia. The title of it is Conquering Fibromyalgia, Real Solutions and
It's conquering your
fibromyalgia,
real
real
answer.
answers and real solutions for real pain. And also you have a podcast under the same title with 60 plus episodes. So I've really appreciated both. I purchased your book via Audible. So I've listened to your voice over and over again, and then also listened to your podcast, several of the episodes. So welcome, and I'm so glad you're here with us today.
I'm so excited to be here on a nice Saturday morning here in
Yeah.
cold upper Midwest. You're Michigan, I'm Wisconsin.
Yeah.
Pretty
Are
sure you're
you?
just getting a little more lake effect snow than we have. We have about 2
Yeah,
inches on the ground, and I think you probably have 2 feet or something.
right. You're exactly right. And I'm looking out my window right now, and it's really blustery, and I'm supposed to drive to my daughter, so I'm not sure about that. She's an
Yeah,
hour away. So
yeah.
anyways, we'll get on to this. So I have to say, I've talked to you a couple of times now, and each time I could have just kept going on with you because you have so much good knowledge, and you've brought to light some things that I didn't even know were connected. So I myself was diagnosed with ADHD at 53, the year prior to fibromyalgia. And I shared with you that I had high doubts that I had ADHD because I've always been super organized. I was a teacher and I had to literally lay everything out. I color coded, I did all this. But I've recently found out because of my childhood, I have complex PTSD. I was the oldest child. I had to take care of my mom. I was, parentified, that kind of thing. And so when we talked about it, you're like, well, yeah, you just came up with a lot of survival skills early on. And that's why you were able to make it until then menopause hit and things went haywire and I couldn't complete my job. I was one of those people who would train teachers. They'd come in and watch me. And all of a sudden, I couldn't have my principal in, who's a friend, to observe me. I couldn't put two words together. And this is what led me to seek out a doctor's help. And I had never heard of fibromyalgia when I went in, and I was very fortunate, one of the few to get diagnosed within 6 months at a local pain rehab, Mary Free Bed in Grand Rapids. But anyhow, I digress a little bit. So I just wanted to talk to you. One, how does someone in the American health system who's just, a family practitioner, unusual in that you do see from birth to death. I mean, you see all ages, right? Because you're a pediatrician and internist, right?
Yes.
But how do you come to write a book on fibromyalgia? I mean, it's just so unusual to find a doctor who knows anything about fibromyalgia, who's in the normal health system, let alone what I would call a general practitioner.
It started, I've always been interested in just learning more and understanding more. So the framework in medical education is really based on what you might call somatic disorders, where there is something that is injured
Mm-hmm.
and being harmed, and that we need to rescue from that. So you mentioned lipidology. What's really cool about lipidology? I'll go on a little tangent from that and bring
I
that
had
back.
to look it up.
So lipid, you get a lipid panel, right? Lipid
Right.
is fat and
Mhm.
all the related issues with cholesterol. And interestingly, in the background, I've always interested in a lot of different things. I remember going to hear about fibromyalgia. I remember the fifth vital sign was pain in the late 1990s, which is I grew up with all of that. And 1992 med school, 96 to 2000 was around that fifth vital sign. And we're trying to learn a lot. We're bouncing from the neonatal ICU to ICU, adult and kid emergency rooms. We're seeing headaches and migraines and accidents and heart attacks and heart failure and atrial fibrillation and people with cystic fibrosis and all
Wow.
all
Yeah.
the different things that we have to learn about. And we're managing all of these. We're rescuing, we're taking care of infections, we're rescuing people with asthma attacks and really doing a lot of rescue care of things that are physically visible. You can hear wheezing, you can treat their asthma, you can see somebody having a heart attack, and there's great things if you can get to a hospital while you're having a heart attack, pop in a stent, and you can be rescued. We love rescuing people. Surgeons
And
love
fixing
rescuing
it.
people. Rescuing and fixing them,
Yeah.
putting them into recovery immediately, take out their appendix and heal up. And that's exciting. I've always been as exciting as those are, and it's nice to help. I liked getting to know people and relationships and leaned towards developing that. And I decided to get into pediatrics and internal medicine. I thought about family practice and I thought I'd do that. And I realized I wasn't going to be likely doing obstetrics as a guy. There's some men who deliver babies, but it's mostly a female dominated thing. And it wasn't this huge passion I had, but I loved taking care of babies and I loved, and a lot of the baby stuff, when I was started in medical, after I got out of medical residency, I did the whole gamut of pediatrics, internal medicine. We'd be rounding in the hospital. And on a weekend like this, when we started in 2000 in a small group of 3 of us that were doing med peds together in this medium-sized town, suburban type town outside of Milwaukee, I'd start in the ICU. I'd see the sickest patients first. Then I'd go up to the medical surgical floor and see less sick people, obviously. And then I'd finish in the newborn nursery and I'd see the happy part. So it's usually a happy part. You'd finish with usually almost all the time, these are happy situations, where the babies are doing well. So I got a chance to see variety. But going back to the pain part of things, we'd have occasionally a pain patient, whether it was sickle cell crisis in Richmond, Virginia, where I worked, or we'd see people I had a case of the week of, in pediatrics, there was the case of the week where you'd have on a Friday afternoon, all of the attendings, all of the residents and med students and interns would gather around and there'd be a case presented that was a learning case. It's really exciting. And I remember presenting a case on cyclical vomiting syndrome. Now, looking back at it, I didn't know much about it, but this kid was skipping school and not going to school and was struggling and was in and out of the hospital. It turned out if I would have taken care of him back then, what I know, I would have recognized that he probably did have underlying ADHD contributing to the school avoidance and the struggles. He may have had other problems, because I've had just in the last 2 weeks 4 adolescents who've had similar stories as him, just who have seen me just by recent findings. So I was very curious. I was always curious about that. I had adult patients who were told they had, quote, chronic pain or fibro and put on fentanyl patches and other things, because that's what we were supposed to do. If you said you were in pain, well, we didn't know that actually treating fibro pain actually with opioids made it worse back then. They just wanted to get better.
Yeah.
And I started to hear stories. I remember going to a neurology conference, and neurology would talk about chronic headaches and migraines. Well, that's interesting. And as a doctor trained in all areas, I'd start taking family histories, a thorough history. And you'd hear somebody with the headaches would have a mom who had IBS and depression and anxiety and other things were in the family. And I remember going to these conferences and reading, and you hear things like Well, anxiety. A lot of these people have anxiety. There's a talk. I'm going to be hopefully interviewing the doctor who's a expert in gut brain problems,
Hmm.
and she's not a psychiatrist. She's a specialist in the gut. But there was a question about how many of these people have anxiety, and it turned out, she said, well, about half of people will report having significant anxiety. She's like, whether it's fully meeting these criteria for general anxiety disorder or not, but she said about half. Well, that's kind of, I call that like, I call a symptom of anxiety is like saying somebody has a fever. It's not diagnostic. It's like saying somebody has a fever.
It's what,
And
yeah, it's
a
what
lot of
the symptom they have, but not
it's a
necessarily
symptom,
the
but it's
cause.
not necessarily a cause by itself.
Mm-hmm.
And so then I remember hearing about that, and sometimes it's chalked up, I think, in the medical field as, well, that's just that anxious patient, that anxious 16-year-old girl who's just all nervous, and she probably got it from her mom because her mom's in the room and in the exam room, and you can tell she's really all anxious, and
Mm-hmm.
it's just probably they just need to relax a little bit.
Right.
But the I go, well, I don't know. Maybe they can't. Maybe there's something going on that is keeping it harder. I don't think they're intentionally trying to be anxious. I think there's something
Yeah,
that's
who would
making it
want
harder.
to? Right.
Maybe this
Who
isn't
would
something
choose
they're
that?
trying to do. Maybe they're not
Right.
trying to get attention and skip out of school.
Mm-hmm.
So I started reading more about fibromyalgia and realizing that there's a central pain processing commonality. And interestingly, there's a huge part of what walks into a doctor's office, whether it's the emergency room, whether it's a primary care doctor's office, whether it's a gastrointestinal doctor, whether it's even a cardiologist. There's a huge amount of people who have pain that is hurting but not harming.
Mm-hmm.
That is, there's no tissue damage being done, but it is hurting to them. And I started recognizing there is this common central nervous system processing problem, and it's extremely complex. Our brain's extremely complex, lots of different connections. And I started just simple things with chronic headaches, recognizing, oh, well, maybe stress, and looking at sleep and schedules in teenagers and recognizing that has a role. But I recognize that treating and talking about fibromyalgia and learning more about it, learning from people like Dr. Daniel Claw and hearing him speak,
Mm-hmm.
who I know he's
He
somebody
was
you've
it.
connected with
So yeah,
in
and
Michigan.
early on, that's at the Mary Free Red. That's who they kind of guided me towards, and so that's been my philosophy of calming
Yeah.
down my nervous system
So
and brain.
Dr. Daniel Claw is
Mhm.
excellent, and it's got a lot of research, and he's a pioneer in the field. He comes from a rheumatology standpoint,
Mhm.
and yet got very interested in the non-harming part of rheumatology versus the
Right.
or I should say it's hurting, but not necessarily harming versus the inflammatory problems that a rheumatologist would take care of, where you can have your joints worn down if you have rheumatoid arthritis. You don't just say, oh, just take some more morphine, your pain will go away. No, there's an inflammation
Right.
literally destroying your joint. Well, in fibromyalgia, it feels like something's destroying you that's really harming you, but it's a hurt, but not a harm. So he had a lot of really good information. And I kind of thought back years ago, time's going fast, maybe it was 8-10 years ago when I heard him speak, I thought, well, surely he will write a book.
Yeah.
And I kept thinking, well, somebody else will do it,
He's written
right?
a lot of research papers you can
Yes,
find.
yes, yes, yes. And,
Yeah.
and he'll put a book together for patients, and I'll just let somebody else do that.
Mhm.
And so I started with my own. So part of the problem with fibromyalgia I found is I would say that they have fibromyalgia. I would say go watch Dr. Daniel Claw's YouTube video, and people wouldn't buy into it. There was really a big resistance to the acceptance of their diagnosis, I felt. That's why one of the chapters in my book is called The Buy-In.
Mm-hmm.
You have to buy in that your brain is processing things differently.
Right.
That's a hard thing to
It is.
really accept.
Yeah,
So I
because we're trained to say, hey, if you're sick, you take something and it goes away. And, so you're telling us, well, this is a whole different ball of wax. You've got to, work on calming your nervous system, that kind of thing. And that's not going to be simple. It's going to take
exactly.
a
And
partnership between the two of us and, that kind of thing.
so I did a 2-page handout that I tried to summarize some things because I didn't think there was a lot of great education out there. It was more intellectual, scientific sort of discussions, but not
Patient friendly.
patient friendly kind of. It
Hmm.
was so I had a 2-page handout. Well, I didn't think that was enough. Then I made a 20-page handout, and that got to be a lot of printing out, and still wasn't enough. And I said, well, I should probably start writing a book. And probably 5 years ago, I started on this process of, I'll start putting some things together, thinking maybe Dr. Daniel Claw will write something. Of course, he's doing tons of research, and maybe somebody else will do it.
Yeah.
And to write a book for the first time is a big undertaking. The fear that somebody's going to criticize you, judge you,
Right.
trying to put things together, connect all of these. But I kept thinking to myself as I read more about what was out in the fibromyalgia book literature, there were some good things that were written in, but then there would be, unfortunately, stuff that was not fully evidence-based and could make people be very frustrated on their path and their journey to get better, and also disillusioned when somebody at the end of a book says, oh, and here's my special vitamin or supplement or concoction to
That's so
sell you,
often the way it is.
is
Yeah.
often in that part. So it's kind of the infomercial driving around
Hmm.
on a Saturday afternoon on a AM radio and hearing somebody selling you oregano oil that's going to cure you, or you have a yeast infection in your gut, and they'll use maybe 80% of the information they share is good information, but then the 20% ends up poisoning the rest of things, and lack of trust. And then I started writing the book and getting into it. And then I just looked, oh, what else is out there? And I said, oh, the Mayo Clinic. Oh, they wrote a book. Unfortunately, being critical, and of course, when you write a textbook, it's written on information that's probably 1 or 2 years old by the time you actually publish it.
Right.
But I thought it more of a pamphlet and a brochure type than a positive message. I remember a
Right.
quote when they said, well, and of course, taking things out of context, or it could be, putting the best construction. But if you don't feel like you can go to a party, well, just don't go, or go for 10 minutes and leave. And I'm like, well, that's not a very positive message. Like,
Hmm.
just admit it. You can't do stuff. And sometimes, which, sure, if you're having a terrible migraine, if somebody, there are times when you have, but it was a little bit superficial. I didn't think there was enough narrative. I
I
didn't think
did
there
read
was.
it, and it definitely made you feel more walled in and unable to do things that,
So,
at
so
least I took it that way.
yeah. So I thought, okay, I need to write a book. There's, these aren't, fibromyalgia is not something that people are going to come out with new books every year that are written. And I need to now put down the evidence base. And the other, talking about the connection to ADHD, is that research has been showing there is a strong connection, or appears to be a strong connection, between ADHD and other central pain processing disorders.
Mm-hmm.
And there's been talking about which studies. There's 3 studies. One was from South Africa, where they looked at the occurrence, how often people who had fibromyalgia were then screened with the World Health Organization version 1.1 questionnaire for ADHD. And about half of those had them. In Netherlands, there was one that was like 25-30%. Then there was a study done in Japan, and people who had chronic pain disorders, it was 70%. So I say roughly about 50%.
Mm-hmm.
And what I've also there, worse your fibromyalgia is, the more likely you are to have ADHD. So the higher your fibromyalgia impact questionnaire score is, the more likely you have ADHD. So it is
Wow. Okay.
An interesting factor to consider. But before looking at these studies coming out, I got into treating ADHD in the early 2000s in adults. Now, I was trained on treating ADHD in kids, so getting back on the ADHD because there's a
I like
connection.
that you have that whole lifespan experience because, yeah, you can see the transition, if there is, between a 13-year-old and a 14-year-old and 18 and 20 and so on.
Oh,
Like
100%.
you have that knowledge.
So my training in pediatrics, I remember going in 1992
Mm-hmm.
when I started med school. They had a lunch hour talk, and I ran into a recent classmate of mine who saw as a patient, and he remembers the same talk, and he had the same thoughts about ADHD. And I kind of thought, graduating high school in 1989, med school in 1992, I said, this is an excuse for people who just don't know how to parent their kids. They're naughty,
Mm-hmm.
and this is just an excuse. In
Mm-hmm.
my mind, of course, I was humble enough to think, I obviously don't know everything.
Mm-hmm.
I don't understand this. And first hearing about it, I go, that's interesting. So maybe they aren't just naughty kids. Maybe there is this real condition. And the interesting observation is that in the 1980s to early 90s is when awareness of ADHD just in kids was occurring. And
Yeah.
as a teacher, I don't know if I can ask when you first started teaching.
I
Not
started
the
in
date you.
1988.
So you were at the same wave
Mm-hmm.
of awareness of that ADHD. I don't even know if you had that term used when you were in your psychology classes in
No,
undergrad,
not in my training, but as a
but
teacher on down the line. But here's the kicker. Both my children were diagnosed with ADHD, but not until college, where my daughter hit the wall with all the reading for her master's degree and such. And my son similar when but in school because of, being I don't know, they just did really well in school. My son could do his math homework easily last minute just before class started, And here I am. My daughter in third grade was in a split class. And so her teacher would be teaching the fourth graders while the third graders were supposed to be working on, and she couldn't concentrate. And she came home and she asked her Uncle Mark, could she wear some of his factory earplugs? Because even if she sat in the hallway, there was gym. Here I am, a teacher, and I'm dealing with kids with ADHD, but my kids weren't this, right? My kids were more the spacey kind of, and I didn't ever think about it, the procrastinators. And I didn't put two and two together at all that they had
so,
ADHD.
so your training back coming in the 80s,
Mm-hmm.
out of school, you didn't understand ADHD.
No, we didn't
You
have
had
any
continuing
training on that.
education, right? And
Right.
you start hearing, probably, I'm sure you've had experts come to teacher conferences and say, hey, there's this new thing called ADHD. Here's some
Mm-hmm.
of the symptoms. And of course, it was always the naughty, impulsive, hyperactive boys who were
Right.
going, oh, that explains that. Those are my headache kids. Those are the ones that all of the elementary school teachers are recognizing, and the boys were much more likely to get recognized.
Mm-hmm.
And so in the 1990s, we were doing med school, and it was just one talk. There's the only talk I had, 1 hour. I think it was an optional lunch talk come in, and so you're busy learning everything in med school, all of the medical problems and anatomy and physiology and pathophysiology, and then you do rotations and you're learning all of these problems. And then I started medical residency. I decided to do internal medicine and pediatrics because I wanted to take care of kids, and I
Mm-hmm.
wanted an in-depth understanding. Most people who go into, if you hear of a med peds, that's often the short that we'll use is a med peds doctor, and there's probably some in your area. They
Mm-hmm.
usually are people who really want to learn things in depth. They
Okay.
really why would you want to get board certified in 2 different boards? Why would you want to take what would take 6 years separately and do it in 4 years? These
Right.
are
Right.
pretty highly motivated people who really want to be an in-depth understanding, and they like to see kids and adults. Majority of them go into primary care, but some may want to be a specialist in developmental cardiology, where adults, kids who grow to adults with those congenital problems are to take care of. So there's a variety of things. So all of my training in ADHD was in pediatrics. So I saw kids and treated kids and diagnosed kids with ADHD in my pediatric training. I saw tons of adults who had ADHD. I just didn't know it. I just, I didn't
know
ask
it
the
about
questions.
myself.
No, didn't know that they had them. So I went to a family practice residency program in the area several years ago, and I did a talk on ADHD in adults. And I asked the first question I said and these are residents in training. I said, so how many of you treat adults with ADHD? And of course, how many raised their hands, right? I knew that 0 would raise their hands. I said, no, you all treat adults with ADHD. You just don't know it. Do you have that patient who is just super anxious and you've tried all these serotonin acting medications and tried referrals, and they've been to therapy and they just aren't getting better? And actually they keep telling you, I'm not depressed, just overwhelmed. I'm just
overwhelmed. That's
anxious, but I'm not depressed. I'm actually just frustrated. And I said, that's your ADHD clue. You're like, wait a minute, I have to pause and reconsider that they might have coexisting ADHD. So just like everybody who has treated their first COVID patient, every doctor who has, they never had a prior patient. So they had that first regimen to try. And I remember treating my first adult patient who had ADHD. And of course, you know why I found out he had ADHD? Because I was treating him for anxiety. And his child came in at age 6 and said, Dr. Lenz, I was just like him in school. He had the classic ADHD symptoms. And now he's working as an adult. Now, he didn't have fibromyalgia. He had general anxiety. And I said, I just read, and I was just being a continual learner. I was told in medical school, half of what you learn changes every 7 years. So you have to keep up to date, keep learning. It takes 17 years for something that's commonly accepted to be routinely implemented in medical practice. I remember reading about this, and there was this adult ADHD version 1.1 World Health Organization questionnaire. So I went through that, and he's like, well, yeah. And I took a history. Did he have issues in the childhood? Well, yes. And I treated him. And he said, wow, I'm functioning better. I don't feel as overwhelmed, and I'm more productive at work. And his anxiety symptoms were less. So then I started recognizing and looking for that in adults. And I always had an interest in mental health issues. I know we classically depression, and we know the impact that depression can have on health outcomes.
Right.
People who are depressed are more likely to have worsening control of their diabetes, their heart disease, and self-management, and
feel more pain generally.
And feel more pain. All of these were there. So I always knew that was a real thing that we had to address. And I think depression is ahead of the curve when it comes to fibromyalgia and ahead of the curve when it comes to ADHD. So we've recognized that. And then I started realizing that adults have ADHD, looking for it, screening, evaluating for it, especially people who are struggling with chronic anxiety and other struggles. And because I've been doing this for over 26 years, you start seeing families where you once you make a diagnosis of one child in the family, it's like suddenly it's a domino. Suddenly or it could be the parent I'm seeing.
So I want to tell you that I hit the wall at school where I couldn't function. And it was like a Thanksgiving of 2017 where I could barely function. I was couldn't put my words together. It was awful. And I came home and my kids were both there, and they're like, Mom, you're just like us. You need to go to the doctor and get evaluated for ADHD. And I'm like, what, kind of thing. And I brought my husband as character witness to my appointment because my GP was new to me. And, sure enough, he sent me to, a psychiatrist who did all the questionnaires and everything. And he said I had moderate to moderately high ADHD, which, as organized and on top of things, but I was always anxious. And then when menopause hit, which you had when we talked about it, you're like, well, that makes sense. All that change is going to make you feel even more overwhelmed. And that's when, everything just kind of,
And there is less likely dopamine levels
right,
with lower estrogen. So
right, which
that,
dopamine's already a
which we've
problem.
now, it can unmask some of those symptoms, make it
Mhm.
more rise to the surface even more.
So you
And
see this whole domino effect within families when,
well, so just recently, this I've had multiple patients. It's just so common. Getting back in the history, I started going back a little bit farther in time. I started recognizing ADHD. And then you start recognizing patterns. Well, people with ADHD often have migraines or have IBS or these pain issues.
mm,
That's interesting. That's interesting. So I just was realizing that these occurred.
mhm,
And if I treated ADHD, people function better. And as time went on, I started recognizing that there probably is a connection between the two. And as time goes on, that becomes a routine part of your practice. I just thought that's common sense. It's just common sense to me, and it should be common sense to everybody.
mhm,
And then I started reading the books, getting back to writing the book, and we'll talk more about what I see in my patients. Is it just me? Or is there very few people out there that recognize how ADHD has so much of an impact on so many other things besides the traditional academic
mhm.
assessments that we might consider? And some people call ADHD the diabetes of psychiatry. It is so inner, its fingers are in everything. And if you have diabetes, it can affect your heart, your eyes, your kidneys, your circulation, heart disease, intestinal. There's so many different things that can affect. And same with ADHD. And that's where I started to bring together this recognition. And I thought, well, maybe other people need to know about this.
Yeah.
And also for my patients. So recently I've had a number of patients, one of them who I was seeing the daughter and talking about this. And now I get a chance. Part of why I did the podcast is I said, go listen to this episode
Mhm.
on.
I listened to, I think it's at least 3 on ADHD with a specialist that I really,
Sure. And if they're coming in for me for a fibromyalgia related problem, when I say fibromyalgia related problem, I'm talking about
mhm,
any central pain processing disorder, whether it's POTS disease, whether it's IBS, irritable bowel, irritable bladder, chronic tension headache, migraines, TMJ, chronic back pain, chronic leg pain. All of those are under the umbrella. Okay.
mhm.
And so when you talk about it, it's nice to hear a longer conversation, a more in-depth understanding why and how my brain is working.
Yeah.
Because for most people, this is the only, for everybody, not most people, this is the only brain they know. It's like
Right.
until you get a pair of glasses, you're like, well, I don't know how I was supposed to see. I mean,
Mhm.
everybody. So my thinking is different. So when I had a recent patient who I was talking about this with, and is getting better now, that's a teenager who's got fibromyalgia, also had restless leg and ADHD, and getting better. And mom listened and she just devoured in one weekend. She listened to over 15 podcasts. And as she's
Because
listening,
ADHD, you start
well,
going.
as many people, if you start listening
Mhm.
to the podcast, especially when I talk more about it, I interview like Crystal, and
Right,
she
right.
shares her story, and I'm just interviewing to one validate. It's nice to have people's stories out there. And I'm not her doctor, but just sharing stories. And the more you have out, the more information you have, the more you can understand and the more you can know. So this patient's mom started listening, and so much of it resonated with her whole story. She's like, well, that's me.
Yeah.
I think I have this. And I was told since I was a teenager that I had arthritis. My mom said, oh, you got arthritis. It runs in the family. You got arthritis. And it's like, you can have juvenile rheumatoid arthritis. It's very
Right.
rare. But
They'd
you
find
don't get
that
wear and
blood
tear
test.
arthritis in your
Yeah.
17 years old. We don't
Right.
chalk it up, which she would have actually, now looking back, that was the early symptoms of fibromyalgia. And so she has listened, and she is a classic woman who has ADHD, who wasn't naughty, but inattentive.
Mm-hmm.
predominant. Internally restless, which then
Yes.
creates this hypervigilant and contributes to a hypervigilant nervous system.
Mm-hmm.
So she's getting her ADHD treated along with comprehensive care for her fibromyalgia. And as I wanted to just bring a perspective that you have to consider this. If
Mm-hmm.
half of people have this, you got to take it under consideration
I have to
as something
say,
that's real.
for me, when I was treated for the ADHD, that issue of the brain fog, I still get it, but not as severe and not as often. And then that, just heavy weight, I can't function feeling also helps with I take Vyvanse. And then my other protocol for fibromyalgia, which I take something called low dose naltrexone, and that the two together seems to give me, you know, 80% of my day, I'm doing pretty well. So, that's one of the things that definitely has helped treating
Yeah.
that ADHD.
And so when looking at evidence, for those who want to hear about evidence of what does the impact of treating ADHD have on fibromyalgia and related problems, as more studies have to be done, but
Mm-hmm.
Joel Young, who's a psychiatrist in Michigan, has done studies looking at chronic fatigue syndrome, which I feel is basically another word for fibromyalgia.
Yeah.
And he showed that symptoms were reduced by about half. He had some
Mm-hmm.
case studies, and he had patients who were treated. Actually, in the study, they were put on titrated doses of Vyvanse to try to find a sweet spot, and their symptoms were roughly cut in
That's
half.
interesting. I like to hear about that, the titrated,
So,
because there's
well,
always,
titrated meaning just try. That's how we treat ADHD.
well,
You know,
yeah, what is there a different dose per person? You know what I mean? That's
oh,
the
sure, sure, yeah, yeah. So so that's what we're trying to find, the right therapeutic
because it's
dose
either
for you.
10, 20, or 30, I think is kind of how
No,
they
go,
type.
well, so for Vyvanse, for example, the
Yeah.
dose is between 10 and 70.
Oh, okay.
So what you want to find is a dose that works well, the sweet spot,
Hmm.
without significant bothersome side effects.
Right.
And unlike other medications like antibiotics that are weight based or
Mhm.
lean body mass based to get the therapeutic dose or recommended dose, you can't use that reliably for ADHD meds. So
Oh.
you could have a young child who does great on 60 milligrams, which would be an average adult dose,
Hmm.
or which
Wow.
would, or you could have an adult who only needs 10. So what I have with recent patients, I'll say, all right, start at 10 milligrams one Vyvanse, and you should notice a marked impact within an hour, and it should last 8 to 10, maybe up to 12 hours. If you
Hmm.
don't notice like, oh, wow, this really works, that can tell, I can focus, I'm in class, in academics, you can see, well, then next day, take 2. I'm pretty aggressive, and I'll communicate every couple of days. All right, how did 3 go? Oh, it helped. I could focus better. This patient with abdominal migraines, my gut doesn't hurt as much. I think I can hope mildly improve. So we're adjusting medication, having close follow-up. I do phone calls every few days and checking in how
Wow.
you're doing.
That's
And
awesome.
then within 2 weeks, meet in person. We're trying to find the right dose. For example, Vyvanse is going to cover the school day and maybe to early evening. Well, we'd usually use a booster
That's
dose of Adderall.
exactly what's happening to me.
So if you're getting 80% of it's working, but it's between
Mhm.
5 o'clock and 10 o'clock at night where you're getting flustered, well, that's where you go and say, I need a booster dose. And that's a shorter acting dose. Adderall is Vyvanse without the amino acid attached. Vyvanse has an amino acid attached, so there's a delayed absorption and theoretically less abuse potential. And how long it lasts in the blood and in the brain is going to wean at a time. So we'll often have to use that evening dose. I got interviewed by somebody who has fibromyalgia, and he works out for 2.5 hours at night. That's his ADHD treatment.
Yeah, so
And
that's
maybe,
something I learned, and I'm actually very thankful to have listened to that about how some young people might not be given medicine, maybe they didn't know they had ADHD or whatever, and because they were so physically active in sports and whatever, they were doing okay. So that's one of my impetus to getting outside, walking in the woods. I think that helps me definitely as far as helping to balance, and especially at night. But when it's like this cold and snowy, and then I'm not going to get out as much. So
Well, and if you're more sensitive to temperature, and this is the November to end of March is the hardest time in the upper Midwest or northern half of the country for fibro, because you have to now do artificial exercise, if you want to call it, more likely to have to walk on a treadmill for an hour and a half instead of hiking through the woods for an hour and a half or working in the yard for an hour and a half over time. So, but if you have a recognition, you have to, a lot of times in the world of fibromyalgia and related problems, is you have to kind of be an advocate. So if you're listening going, well, that's me, it wears off at 5:30 or 5 or 4 o'clock. Well, you have to go in and say, I need a booster dose. Now, the problem is if you're an adult, they're like, well, do you have classes that you're struggling with?
right.
Well, what's the problem? It's like, well, I have a hard time focusing and hard time concentrating. And I just don't have, I just get overwhelmed, and I feel tense and I feel anxious, and I don't get things I need to get done, and I hurt more.
Yeah.
And part of the connection between ADHD and fibro is that the problem with ADHD, and people have often this idea that it's the word ADHD is a bad name, attention deficit hyperactivity disorder. You don't actually have a deficit in attention. Did you know that?
I have hyper focus on everything.
No. Well, it's not, hyperfocus is a separate thing. That's a separate
Okay,
term.
okay.
But you actually have attention on too many things. You have so many things so many more thoughts that are going through your brain at one time that could be a help, right? Why would having tons of your thoughts be a positive? What do we call when somebody has all these different thoughts in their head, but it's positive?
Yeah, creativity.
Creative.
Yeah.
You have all these ideas. I think outside the box, all these different riddles and problem solving. But if you have where most people have 80% of their thoughts are negative, I can't get all of these negative thoughts, and they start to chew on negative thoughts. That becomes a problem. So the connection part with fibromyalgia is I can't focus on external things that maintain my attention. The pain symptoms, I get hypersensitive to stimuli, and my sensor for stimulation, or this feeling the stimulation, is very heightened.
Mm-hmm. Amped up. So part of the ADHD brain is a hard time focusing on one thing. It's an interest-based brain as well. So everybody wants to do stuff they're interest.
so everybody wants to do something they're interested in, but people with ADHD have a hard time doing things they're not really interested in, much more than the average person.
Mm-hmm.
So if you can get somebody interested in something, so an example for an academic situation can be a student who's struggling in social studies. Doesn't really like reading the textbook, doesn't really like writing a paper and doing research on the stuff the teacher told you. But they just got into this World War II thing, and they just find it fascinating. And they just totally get into World War II, probably know more about World War II than the teacher does, or as much, depending on.
I've had students
but just have them memorize terms for a history test or a quiz, and fill in, that's stupid, I don't care. And so that's part of that hyper focus, getting something you're in. And so when it comes to the connection with fibro and ADHD, is that people who have an ADHD brain have less of activity within the prefrontal cortex. So they have a hard time contemplating things deeply, and are much more likely to be emotional thinkers.
Mm-hmm.
And so they often are having an emotional reaction. And the amygdala, that part of the brain that is with emotions, is also directly tied with the alarm system and that fight or flight system. So if you quickly are reacting, and so if you've had trauma that you were exposed to and you have learned pathways that I get into that fight or flight mode, but literally it's a false alarm, right?
Right.
The deer sees me. I have deer that'll be running through here. I'm not a hunter.
I'm not going to
but
hurt
they
you.
think
But, all right.
that
Yeah.
they think I'm a hunter. So they get that on edge. They're always jittery, on edge, right?
Mm-hmm.
So you get into that fight or flight mode, and your body is always on this hyper on edge, hard to relax, that overdriven sympathetic nervous system on edge. And that is good for a lot of things. If you're a watchdog, if you're guarding something, if that's great, but it's terrible on your body
Yeah.
when it's a false alarm, there is nothing. And if you don't, so what the ADHD part is, it allows you to use the prefrontal cortex, that contemplative thing, and not jump to that emotional reaction. So
When treating it.
when you treat it,
Mm-hmm.
you have the benefit in putting into practice. And that's why if I have a patient, and this affects so many different aspects, it's all of these are interconnected to other health
Yeah.
problems.
Yeah.
If I have a diabetic patient who's got untreated ADHD, try to get them to control a complex problem like checking your blood sugars, modulating insulin, and
Yes.
modulating emotional eating.
Yes.
I'm putting a script together for a podcast talking about sleep and emotions and the connection with our sleep deprivation, and talking about how, if you're more likely to have, if you have ADHD, you're more likely to have a screwed up sleep schedule.
Mm-hmm.
Because when you're trying to fall asleep at night, what are you supposed to do? What's good sleep hygiene? Well,
Not look
for
at your screen.
90 minutes
Yeah.
before bed,
Mm-hmm.
you should begin to wind down your day. You know that.
Mm-hmm.
Turn off the TV, turn off your screens, wind down. But the problem is people with ADHD have been busy throughout the day, distracted by things, a little bit of this, a little that. It's nothing seriously. Often maybe it's just doing simple housework or other things. And finally at night, they finally want to do those fun things, those dopamine releasing fun ADHD activities. And they're maybe getting ready to, they're kind of battling. I'm tired, yet I have this surge of energy and enthusiasm. Or I have all of these thoughts because when I'm doing the dishes, it's hard to literally think about lots of other things at the same time as washing a dish or doing the gardening. I'm focusing on that, and that keeps my attention there. Now, when you literally put the phone down, put the book down, lay in bed, now you have all of these thoughts bouncing in your head, which then can, if 80% of your thoughts are negative, and then if you've had some negative events in your life, there's a connection between PTSD and PTSD and ADHD. And what they're finding is that, and I've had patients where we treat their ADHD up until the point they fall asleep, and they can filter out and do all of the things that you hear, like, well, meditate, relax, all of those things that non-ADHD brains can do much better.
Mm-hmm. Mm-hmm.
And they have a hard time implementing those strategies because there's so much that's bouncing around. But now I can filter those things out. I can actually do those calming, mindfulness type activities, and then let my nervous system settle down and not get revved up, and then get this second wind, and then stay up till 1 a.m. doing this hyper focused, cool stuff that they think is neat. But then they finally fall asleep, but then they wake up and the alarm, it's at 6 o'clock and 5 hours of sleep, and then they're tired.
Okay, so I told you that I'm struggling from, let's say, 5 on, and I tend to go to bed 9:30, 10, and sleep is on and off, but generally I would say I get pretty good sleep. But where I'm struggling, and I think this might be the ADHD part in me, is eating healthy. Like I start almost wanting to binge eat. I'll just go get some nuts, just a little bit, and then I'll eat that, and then I'll be like, I really want something sweet, and I don't keep candy in the house, so then I'll go get some dried cherries and I'll eat some of those, and then I just keep wanting to eat and eat and eat. Whereas I'm very good all day long, and I have kind of listened a little bit about the ADHD and making good choices and things like that. And I feel like also that's when my brain, like I can't do anymore. So I just sit and stare at TV, or, I'm overwhelmed, so I can't do any of my projects anymore. So I'd like you to talk a little bit about that. And I'm going to be honest, I'm very I don't even know how to talk to my doctor about a booster dose.
Okay.
But anyway.
Well, share the video, share this link.
I
Okay.
will. I will. I will.
But if you were a child who is in school,
Mhm.
or an adult child, a teenager, college student who finds that they are good, and then by 4:30 they really struggle in getting their homework done, and they have now demanding classes that require 2 or 3 hours of homework after 5 o'clock at night. Well, the grades were struggling as a consequence. Well, the doctor would be like, all right, well, we need to get a booster dose. That's just a normal thing.
Is it? Okay. I'd
That's
never heard
what
of that before.
Yes, no, it's just the
Okay.
after school dose if you
Okay.
have to. I bet
Yeah.
your kids probably take that. If they have
Yeah.
if they have adult challenges in the adult world, they need to study in the evening. Study
Mhm.
after practice, after basketball practice is over, and the kids have to come home and study in the evening, and they have to be productive. Otherwise, they'll be spinning their wheels.
Right.
Interviewed Dr. Dodson on the podcast earlier
Mhm. He
in
was
the year, and
very
he said
interesting.
very, very excellent, very passionate. He's passionate about ADHD like I'm passionate about fibromyalgia,
Mhm.
and it's kind of dedicated his life towards treating and working and doing research on people with ADHD. And he said people with ADHD will spend twice as much time to get half as much done.
Mhm.
So if you're studying, it will take 4 hours of studying is what a non-ADHD brain of the same intelligence can accomplish in an hour. That is not good when you actually have 4 hours of real stuff to accomplish.
Right.
So it ends up causing higher levels of anxiety. So specifically about the food is that what did we learn earlier before the power went out or my internet here
Yeah.
is that ADHD is much more of an emotion-based brain.
Mhm.
So as
Yeah.
Dr. Dodson has I've borrowed some quotes. You know, I'm a lifelong learner. When I interviewed Dr. Dodson, there's a couple one-liners that he shared. He said, people with ADHD don't have a problem knowing what to do. You know what the second part of that corollary is?
No.
They have a problem doing what they know they should do.
Yes.
You have
Oh,
no
yeah.
I encourage eating whole food plant-based diets. So getting in that whole lipidology world of things and the connection with food. I try to do the best of lifestyle medicine. And those who don't know what lifestyle medicine is, it's at the foundation, it's healthy food choices, predominantly a plant-based diet, stress management, exercise, sleep, addiction, kind of a whole comprehensive approach to things.
Mhm.
Not saying that medications aren't necessary, but those are at the foundation. So I've gotten into that because I realized that for the world of cholesterol and heart attack prevention, that statins, for example, are very effective for those who need them, but it doesn't prevent everybody from having a heart attack.
Mhm.
And recognizing the role of food choices and smoking cessation and exercise and stress management and good sleep are all playing factors. So I have a strong interest in the whole world of eating healthy and encouraging people to eat healthy. In fact, I prescribe plants. I have my license plate says Plant RX, which is one of the questionnaires. Have you ever done the Fibromyalgia Impact Questionnaire?
Yeah. Mhm.
So the second section, the second question in the second section is from 0, not at all or never, to 10 all the time. How overwhelmed do you feel?
Mhm.
That question very much overlaps with ADHD.
Right.
And people who get their ADHD and their ADHD part of their fibro treated, and I come back and we look at that, that gets reduced. Maybe it goes from a 10 to a 5 or
Mhm.
goes to a 2. And it's
That
funny.
was my case. I went from a 10 at that time to, probably a 6. And
Mhm.
then with other types of,
Yeah.
you know, things that I do, I've limited or lowered that quite a
So
bit.
that overwhelming feeling
Mhm.
is a driver, and that overwhelm is connected with emotions. So it's in one sense saying I'm deactivating my emotion decision-making part of my brain. And I'm able to contemplate my internal cues. I'm not hungry. I'm literally eating. I'm not bored, and I can read a book right now. If you ended up saying to your doctor, I'd like to try a booster dose, and that's equivalent to use in the evening, I think it's definitely going to help me in so many ways. And part of a lot of the ADHD brain ends up going into a shame cycle because
Oh, yeah.
you end up having more negative thoughts. Why did I do that?
Mm-hmm.
While you're laying in bed.
Or
Well,
why
that
didn't
wasn't,
I do that? Or
well,
yeah.
yeah, why did I wasn't even hungry. I guess I'm so stressed.
Mm-hmm.
Maybe I should have wrote and done journaling. I should have painted or played music. There are other dopamine things that can be done. Maybe I should have gone for a walk after that. And I do better when I do that in the evening. But
Yep.
the problem is it's often hard to get started. And then if you hurt more and you have more pain and you're not in that routine, you end up,
It's
and if
harder and harder.
you end up having coping strategies that is a are called maladaptive behaviors. They're called bad.
Mm-hmm.
People who have a hard time following a whole food plant-based diet are much more likely to have ADHD symptoms. But when we treat that, now they can have the benefits of both of them. And kind of getting back into connecting all of the dots, as you might say, well, golly, Dr. Lenz, if you're saying eating healthy helps fibromyalgia, which it does,
Mm-hmm.
and treating ADHD can help. Well, what if we did both at the same time? So you're actually having the worst pain in your day is probably between 5 o'clock and midnight.
Mm-hmm.
And you would now have a positive evening time in the evening and more likely. So I
Right.
can't give personal advice, but those are people, if
Yeah.
it would be looking at that and having that awareness.
Yeah.
And if you're like, well, if somebody's getting it filled on time and as appropriate and getting a medication with that. But it's funny, I got interviewed by a fighter's story, another person in Michigan who talks about his story. And I want to get him on my podcast again as a guy who's been through fibro. He had no idea that his ADHD was connected to his fibro until we were talking about this. He had no idea. He had
Right.
been to the Mayo Clinic. He had been to all these doctors, and even his current doctor. After he had me, I had him on my podcast, or I was on his podcast. He went to his doctor after that, and he said, "I've never heard of such a thing," and that these are connected.
Yeah.
But
I told my GP that as well. After one, I had done previous research on it just because I thought with my situation, I want to write about it. I want to,
mm-hmm.
That's how I deal with it. I learn for myself and then I share it out. But then also reading your book and talking more with you. When I next saw my GP, I was like, did you know that people with fibromyalgia, probably 50% of them have ADHD? And he was not aware of that connection at all.
Yeah.
And it's not just in the medical, because I think those of us with fibromyalgia don't assume any of our doctors really understand fibromyalgia, period, right? But I'm talking in just the wider world of information that's out there, different other people like myself who share. Nobody talks about ADHD that I've seen. And so that's one reason why I wanted to bring you on, is to kind of open this discussion and get people more aware that there is a connection.
And in one sense, they are talking about it. But like the saying,
Talking
old
about
saying
the
says,
anxiety, overwhelm, all that.
yeah. So like the old saying that says, if a tree falls in a forest and nobody's there to hear it, does it make a noise? Yeah. All of the ADHD is being spilled out. If you look at, you have to know what to listen for.
Right.
Overwhelmed, anxious, hard to stay on task. If you listen to the interview with Dr. Dodson, I list the symptoms of fibrofog to an ADHD expert. And I said, well, Dr. Dodson, what does that sound like to you? And he starts to laugh. He's like, ADHD. The problem is when you have complicated problems and complex problems, and you get specialists involved, they are a specialist in their own aspect. So I don't know if you got a chance to listen to Dr. Chayette, the interview with Dr. Chayette. She's a pediatric neurologist.
I can't remember if I did listen to
it's the episode. It's from August or so. So if you go on my website, it's a 3-part series I did talking with her about the connection between headaches, migraines, abdominal migraines, and bringing up ADHD.
Mm-hmm.
She's a neurologist. You know how many neurologists know about and it's a brain problem, know about fibro? Very little. Do you know how many know about ADHD? You'd think, oh, they must know ADHD.
I would
That's a
think a
brain problem.
lot. Yeah.
No, they don't.
Oh.
Do you know how many psychiatrists understand fibro and migraines? Very few.
Hmm.
So you end up having experts. So you might have gone to a psychiatrist who
Mm-hmm.
made the diagnosis or psychologist.
Right.
And it'd be nice if you didn't have to do it because there's not enough psychiatrists and psychologists in the world that diagnose everybody with fibro out there. And the problem is
Especially as an adult, they're not gonna, the insurance and everything else won't
well,
even.
potentially and the
Yeah.
capacity for that. That's why doctors have to take, just like you learned how to treat COVID, have to be adventurous and expand their horizons and what they can treat. So if you, with the psychiatrist you saw, and if you said, do you think your psychiatrist had any idea that there's a connection between ADHD and fibro?
He
Probably
didn't
not.
mention it for sure.
He
And
didn't.
I was starting to already have the symptoms of the fibro.
Sure.
I had interstitial cystitis
Yeah.
prior, which is chronic pain, which I had never thought of it like that before.
Yeah.
But yeah, he never even
So you end up having,
that
quote,
I
an
had.
expert in one area does not have the connection between this other area, right? And so, and if you're working with primary care doctors, when there's a complicated problem, they're like Pontius Pilate, throw it up in the air, pass you over to King Herod, and then he is a specialist, does a few tests, kicks you back to Herod. Herod loses sleep over these patients, wishes they would just go away, right? I always kind of imagine that many of the scenarios for a fibro patient is they've been to all these specialists, you end up bouncing back to the primary and they're still struggling, and the primary puts their head down and kind of mumbles a couple things and realizes I'm incompetent and I don't know. Please don't expect much from me. I don't know what to do with you.
Yep.
Can you just kind of, I don't know, go away? But if that's part of the book, and the podcast is directed at doctors too that can listen to this and go, wow, this is actually evidence-based. There is a connection. People give up hope.
And so I want to end our time where, within my blog, that's my focus, is what's worked for me. And of course, I can only share from my one experience and then research and that kind of thing. But as a doctor who has seen quite a few different patients, if you were to try to give them 3 suggestions, somebody who's newly diagnosed or maybe just not getting the proper treatment at all, would you give us maybe 3 top suggestions of what to do?
Yeah.
Get
You have to get informed. You have to understand what is going on. That's the most important thing. And I try to do that as best I can with my book. I try to do that with my podcast so that people understand.
I would highly recommend, because you have, like in your first episodes, what is fibromyalgia, how to get diagnosed, that kind of thing. And then you get into more detailed, specific topics like sleep and, all that. So that's a very good source. And there's a lot of other sources out there.
I would encourage you to write your story down from the beginning.
Timeline, if you can.
And things that you never thought were that significant, like, well, I did have really painful periods, come to think about it. I had a recent patient of mine, we saw this last year, who's completely recovered, reversed her fibromyalgia, who went from extreme levels, fibromyalgia impact score of like 90, completely normalized within a couple months. And she said to me, I read in your book about this painful periods. And she said, and we were talking about this, and she said, I never knew that it was not normal to have severely painful periods.
Yeah, we're just
That's all I've ever.
Some girls do have that, and some don't.
And now I don't have hardly any pain with my periods. So recognizing, writing down your story. Well, I did have growing pains as a kid. Mom, was I colicky? Oh, I
Right.
remember having gas pains
Right.
a lot. And I
Yeah.
remember summer was always better for me. And then school. I remember falls, I get headaches, and I remember
Uh-huh.
all of these going back. And I remember I was doing okay. And I got married and life was great. And then those darn kids came along and I stopped and I didn't sleep well and I had heartburn and then I was stressed out and maybe my ADHD kicked up with each pregnancy as I felt more overwhelmed and I didn't notice that. I thought it was just being a mom and that's just what you expect.
Right.
And so if you can
So
write down your
more
story, the ups and the downs and
detailed.
things
That's
that you
awesome.
might be related, that gives you an insight. I don't know if you've heard of Dr. Sarna or any of
Yes.
his people. So
Actually, I see Dr. Howard Schubner, and I have done a timeline and connected some of those very stressful times of my life to various things that happen pain wise and whatever. Yeah. So
so part of that can be um, awareness that stress impacts me
mhm,
that I wasn't aware of. Now, what you're hopefully learning, one aspect is ADHD may be a factor that's making you handle that is more than just gonna this that needs to be addressed more than just journal it.
right.
It's
Yeah.
like somebody having academic struggles and go, whenever I take AP classes and take challenging classes, I get more headaches.
Mm-hmm.
AP classes make me, whenever I have a job that's cognitively demanding, I hurt more.
Uh-huh.
Okay, I have that awareness, but I have a job that's cognitively demanding. Well,
So I
I can
have,
treat that.
yeah,
So,
yeah.
so I think writing a history down, and not only is it helpful for you, but if you're going to a doctor who's at least neutral, isn't against people with fibro, and maybe they're
Right.
new, and you could be a great messenger at
This is
a
where patients can advocate not just for themselves, but you.
for future patients so
Mhm,
that they can learn and
mhm.
they can share. And if they're like, yeah, I didn't have a lot of training on that, and ask how much have you had in sharing this, because I wanted, again, with the book to be smart enough that a doctor can get out of
Right.
this. If you read it, it's pretty high level of things. I don't just have this cursory,
You put in
maybe,
a lot of the research and all that so that doctors would then
yeah, there's,
understand it,
I,
buy into it. Yeah.
exactly. So if you're then able to put that information in and write it down in a timeline and see all these connections and and end up, unfortunately, bringing this information that I've already done all of these. I think I have these coexisting things. This is what's going on. I've tried these things. This is how much it's helped or hasn't helped. Then that can make their job easier because it's a long amount of time. And please try to do a separate visits for your depression or for your diabetes or high blood pressure.
Ah, yeah.
Um, I was talking on the pediatric talking with pediatric doctors who their kids out there. Pediatricians are used to 10-15 minute appointments.
Right.
One of the reasons why people go into pediatrics, example, is it's one problem and they're short problems.
Mm-hmm.
When you start dealing with chronic things, the pediatricians will refer. They'll send it off really quickly
Mm-hmm.
because that's complicated. Well, you actually are in the driving seat. That as a pediatrician, you actually can hopefully know more about this than the specialist does, the encoparesis specialist, the constipation specialist, because most pediatricians should know about ADHD and just ask the questions. Oh, they're connected. Maybe I should treat that. But then make sure when you go up front and saying, okay, I want to have that 45-minute follow-up appointment. Hopefully the doctor will have that and you can work through things.
Mm-hmm.
And, but having some hope and some things that you can know that this can get better
Mm-hmm.
is a key, I think, to this. So, information or education, writing your story out, and hard to pin down. I'm trying to think of a.
Well, for me, the having the hope part is finding what I'm passionate outside of myself, because as a fibro patient, when you're in pain, you can just start really focusing just on that. And of course, then that drags me down, right? And then I stay in bed or whatever. But if I can focus on other things that I'm interested in, and maybe this is my ADHD too, but then it gets my mind away from that. And it's almost like, yeah, I'm in pain from head to toe, but it's in the background music.
Yeah. And
And I'm into something I really care about.
and the connecting with in the book that Your Brain is Not Broken by Dr. Rosier. She talks about different ways of an ADHD brain works. And the ADHD brain has what she calls red, yellow, blue, and green areas. Red are areas where people are on the edge of adrenaline. It's procrastination.
When I was with my friends, we were in Colorado, fresh air, you know, all the things I love around me. I stayed up pretty late and I had energy and yeah.
Yeah, and you had positive things you're getting, and so I'm wired that way. So what I have to do in the evening if I don't treat my ADHD is, and you aren't going to be able to hire a bunch of people to be your friends and show up and laugh and have fun all the time, but there are fun other options that I can do to help cope.
I think with the fibromyalgia piece, you know, I mean, with the pain, if we can, you know, not focus in so much on it, you know, which is really hard when I was in bed and really feeling it. But little by little, I was able to get more focused on life outside of that. And I still have it within me, but all day long with other things in place, I'm able to kind of put that in this back burner that it's there, but I'm not focusing on it. I'm focusing on talking to you, so it's not overwhelming.
And I think there's a lot of fear. You know, often people over the years, I would hear people talk, may not be fibro, might be chronic pain of some kind. And they'll say, well, I know it's there, Dr. Lenz, because once I get done gardening, I can feel it. Oh. I know it's there, Dr. Lenz, because once I stop doing stuff, I'm not, once I stop focusing on things, I know it's there. And there's something like a cancer that's eating away at my body and my bones.
That's how I felt in the beginning. And now I know
that it's hidden, and I'm ignoring that. Now, this is a tricky part. And I talk about this in one of my earlier podcasts, is how history is so important. Well, you could get cancer and have fibro, so you have to be watching for red flags.
You have to do your due diligence, and
you have to be monitoring is what's different. So not everything's fibro. A lot of what somebody sees in a primary care office is fibro. And I guess for me, getting back on why did I want to do this, it is one way to serve and connect and help others. It's like people who have gone through fibromyalgia, like it talks about in the Bible, I did this for the least of these. People who are going through this often feel like they are the least important person in the doctor's life and everybody's life, and that there's no hope. And just sharing some of these insights, how our incredibly created brains and bodies have some things that are tweaked different. And then you live in not the Garden of Eden anymore. Maybe you're somewhat close to that when you were in Colorado. Right.
Yeah.
You have external things.
Right.
To contend with. A design that's tweaked a little bit, right? Those are the weeds of the world that we have in an imperfect world that we're in now, and making sense of, okay, I understand a little more. What can I do? One of the things that I was a little worried is like, okay, what if all this book got out to patients, but doctors never read it? There'd be highly frustrated patients who want to see me, and I can only see so many people.
Right.
And recognize that the doctors have to recognize that this is important. Dr. Dodson, there's an episode on ADHD. He says ADHD is not an optional diagnosis. It's not optional whether you diagnose it, and it's not optional whether you treat it. People with ADHD have a shortened lifespan by 13 years. So when people talk about fibromyalgia, they go, well, it doesn't kill you. Well, if you have fibromyalgia, it actually might shorten your lifespan because you end up getting more maladaptive behaviors and choices when you're younger. You often are more likely to do impulsive dopamine releasing activities that impair you, more likely to drink, get addicted to drugs, drive fast, drive intoxicated. And
Yeah, all that thing.
and then when you're older, you're more likely to be a binge eater, smoke, have uncontrolled diabetes, hypertension, and all of these things than an unaffected. So, but if people with fibromyalgia often think of their fibromyalgia as like a stage 4 metastatic cancer, and you're on palliative care and there's nothing you can do. And I said, that's a false framework. I said, you can reverse fibromyalgia. You can recover this. And nobody wanted to hear that because I think it's so drastic of a statement that nobody's ever putting out there. Or if they've heard that, it's a false hope.
It's been a false hope thing.
That it's been supplements.
And also
and
it
other
might
stuff.
be connected to the history of fibromyalgia in that you were told that you're nuts and, you know, it's all, you're making it up, you're overreacting.
Yeah.
And so now the way doctors treat it, or at least from what I'm hearing and, you know, is, well, this is a chronic forever thing that you will always have, and you just have to deal with it, rather than giving hope that, yes, you're going to come up with strategies and different things that you do so that you can live more fully. For example, I was doing the pacing and it was walling me in. And then when I was meeting with Dr. Schubner and that I had been invited to go backpacking, I hadn't done it for, you know, quite a while. I didn't think I'd be able to do it again. And I did it, you know, I mean, I had backup plans. I had my myofascial release balls with me.
Yeah.
I had, you know, all that. But I did it and I felt great. And, you know, so I feel like so often we're told that we have to limit our life, rather than, no, you're going to be able to, you know, figure out ways to conquer your fibromyalgia. So.
Yeah. I think that's good. And that's where recognizing a little more, just offering some
Hope.
Insights and hopefully to get the word out there to more people that some of this. I think one of the things that probably connects it out, and I don't know if this was part of what you got from reading and listening as you go through, but I've heard this from so many patients of mine. At the end, maybe I'll say this, is that often it's bittersweet, the reaction. The sweet part is you get better, but what's the bitter part? The bitter part is, doctor, do you know how many doctors I've been to before I saw you? You just put this all together. Why didn't all my other doctors figure this out? Now, depending on where you come and how bitter you are, but there's a certain amount. And so when I get a chance to take care of somebody who's a mom
with it for
in her 30s
years and
recognizing like, I'm not going to wait for my child to suffer and wait till they're hitting 47 or 50, going through perimenopause and lower dopamine to finally treat it. I'm not going to dismiss that intelligent people can't get fibro and or can't get ADHD, and not going to dismiss that. So that is hopefully more and more that it'll become routine. You come in, we screen for this. This is what we look for. We do that. Everybody gets at least evaluated, and you ask these questions. And then the problem is you got to be then prepared to treat that. And the problem for those who are adults who go through the World Health Organization version 1.1, I'd encourage you to actually do the DIVA, DIVA 2.0 adult ADHD interview. So one out of the Netherlands, translated into English. You can pull up the PDF online. It has a lot of pointed questions that go into more detail. For example, perfectionism is a sign of ADHD. So you may think, oh, I'm super attentive. I'm hyper organized. Actually, that is part of ADHD, is this hypervigilant, this perfectionism, similar overlapping. And so that if you can bring that into your doctor and your visit ahead of time, that those are connected, and hopefully that this becomes more of a routine thing. But you have to have a doctor who wants to then treat. So most of you listening who are adults who have ADHD, it's hard to find a doctor who treats adults with ADHD. They will be worried because it's a controlled substance, possibly. And they so they may just dismiss it. So it ends up being few people, probably similar to fibromyalgia. There's few people who want to treat that, want to get involved,
Right.
and ends up
So you have to look
where
for,
you end up having to then have a whole bunch of doctors who then are willing to go, okay, this is somebody who's legit, wants help, and is getting benefit. And then when you start to have a positive outcome, well, then they go, well, gosh, I have a lot of patients like you. What if I ask my next patient who didn't even bring all this information? Hey, I'm going to do a widespread pain index for you. I'm going to do this symptom severity score. I'm going to have you go home and do this Diva
I'm going to
2.0.
make sure both in the video and then in my post where I'll put this video to have these links to the various things you've been talking about, because I do think they're very helpful resources. And I know your book refers to a lot of these things as well as your podcast does too. So
well,
I thank you so much for being
it was enjoyed.
here.
Yeah, hopefully put that together and getting it out to as many people. And if anybody wants to reach out to me and have questions they would like to be covered on the podcast,
That's a great idea.
if they can always email me about general questions. Always be sharing on that. If they want to email me at drmichaellenz@gmail.com, they can even do a voice recording, get on the air, here's my question, and some of those, and see if I can understand, help you understand what you might, some questions that you have. If you have the question, odds are, like they say, hundreds and thousands of people probably have the same question, right?
Haven't asked.
Yeah.
So thank you very much, and I'll
You're welcome
to put that information as well in the post and in the video section. So
yeah, sounds good.
We'll talk to you later.
Take care. Bye-bye.
Thank you. Bye.